Hi there, my name is Mairead C, and today I'll be presenting the muscles of the upper and lower limb. I hope you enjoy. Here is just a few questions we came up with regarding our topic. The first topic we're going to go over is the shoulder joint muscles. The movement of the shoulder joint is from the pectoral girdle and the glenohumeral joint. The muscles that move the pectoral girdle originate on the axial skeleton and insert on the scapula and clavicle. These muscles both stabilize the scapula and move it to increase the arm angle and movement. The pectoralis minor is a thin, flat, triangular muscle deep in the pectoral major. It helps depress the scapula. The serratus anterior is a large, flat, fan-shaped muscle positioned between the ribs and scapula. It is named from the saw-tooth serrated appearance of its origin of the ribs. Together, the pectoral minor and the serratus anterior are in the anterior compartments of the eccentric shoulder muscle. Here's a quick look at a posterior muscle of the pectoral girdle. This picture is from our textbook. Now we'll be talking about muscles that move the pectoral girdle. The pectoral thoracic muscles consist of the trapezius, the levator scapulae, the rhombin minor, and the rhombin major. The trapezius is a large, flat, diamond-shaped muscle that extends from the skull and vertebrae column to the pectoral girdle. The superior fibers of the trapezius elevate and superiorly rotate the scapula. The middle fibers work with the rhombin muscle to retract the scapula. The inferior fibers depress the scapula. The levator scapulae is a narrow and long muscle. It is deep to both the trapezius and the sternocleidomastoid muscle. Its primary action is to elevate the scapula. The rhombin minor and the rhombin major are located deep to the trapezius. They help elevate and retract the scapula, and when you stand up straight with your shoulders back, the rhombin muscles are anteriorly rotating the scapula. Next, we will be talking about the muscles that move the glenohumeral joint/arm. The latissimus dorsi is a broad triangular muscle located on the inferior part of your back. It is the prime arm extender. It adducts and medially rotates the arm. The pectoralis major is a large, thick, fan-shaped muscle that covers the superior part of the thorax. It's a principal flexor of the arm. The pectoralis major is anterior and the latissimus dorsi is posterior. Also, primary attachment of the arm to the trunk. They are the prime movers of the glenohumeral joint. Next, we will continue talking about the glenohumeral joint and arm. They are termed the scapular muscles because they originate entirely on the scapulae. These muscles include the deltoid, the teres major, the rotator cuff muscle, and the coracoid bronchialis. The deltoid is a thick, powerful muscle that functions at a prime abductor of the arm. It also forms the rounded contour of the shoulder. The teres major works with the latissimus dorsi by extending, adducting, and medially rotating the arm. The rotator cuff consists of the subscapularis, the supraspinatus, the infraspinatus, and the teres minor. They provide strength and stability. The rotator cuff muscle attaches the scapula to the humerus. The coracoid originates on the scapula. It adducts and flexes the arm. It inserts in the middle of the shaft of the humerus. Next, we will be talking about the arm and forearm that move the elbow joint. The bronchialis of the prime mover of the elbow flexion. It is located in the upper arm and lies deeper with the bicep bronchi. The bicep bronchi is located between the shoulder and the elbow, and it is a two-headed muscle. Its function is flexion of the elbow and supination of the forearm. The bronchioradialis is a flexor of the forearm that is also responsible for pronation and supination. It is attached to the distal styloid process and the lateral supracondylar ridge. The tricep bronchi is a large three-headed muscle located on the back of the upper arm. It is the primary muscle used in elbow extension. The pronator teres is located in the forearm and is responsible for pronation. The supinator is located on the upper third of the radius and supinates the forearm. Now we'll be talking about the forearm muscles that move the wrist joint. These muscles, there are three groups. The first group is the supinator muscles, and these muscles are able to rotate the radius in opposite directions. These muscles are able to move the wrist, hand, and forearm anteriorly or superiorly in almost 180 degrees. Next, the pronator teres are located below the elbow. The function of the pronator teres muscle is to rotate the forearm palm down. This function is also known as pronation. Pronator teres syndrome is caused by overactivity of the pronator teres. My brother works at his desk a lot and on a computer, and he uses this muscle a lot. So I believe he has this syndrome. Yeah. Pronator quadratus. The pronator quadratus muscle is located near the lower part of the radius. The function of this muscle is to rotate the forearm and keep proper distance between the ulna and radius. This muscle is responsible for turning the wrist and palm of the hand. Next, we will be talking about the forearm muscles that move the hand and fingers. The thenar muscles located within the hand are essential for gripping and flexibility to occur. The abductor pollicis brachis and the abductor pollicis work alongside one another to allow constructive movement of the thumb. The flexor pollicis longus, located within the forearm, works with the flexor pollicis brachis to flex the thumb to create a fist. The opponens pollicis is a muscle that allows the thumb to stretch across the hand in order to be able to pinch small objects between the thumb and finger. The hypothenar is a group of three short muscles. In order for fingers to separate, the flexor digiti minimi flexes the little finger, while the abductor digiti minimi works on moving the little finger in order for a cupping position of the palm. The opponus digiti minimi rotates the fifth metacarpal and pulls it in opposition with the thumb. Located in the center of the palm, the intermediate muscle move the second through fifth fingers and the metacarpals. The flexor digitorum profundus is attached to the tendons which allow for extenders of the phalanges to flex. Each lumbrical muscle is joined to a digit, causing the digit to flex at the base. The four palmar interossei muscles are stretched from the metacarpal and placed on each finger. Next, we'll be talking about the muscles that move the hip joint and thigh. These muscle groups are the anterior, posterior, adductor, and abductor muscles. The anterior muscles' function is to flex and bend the thigh at the hip. The muscles included are the liaoposseous group. The posterior muscles included are the glutimus maximus, the hamstring group, such as the bicipiformis, the semimembranous, and the semitendinous. Its function is extend and straighten the thigh at the hip. The abductor muscles' function is to move towards the body's midline. These muscles include the pectineus, the gracilis, adductor longus, brevis, and vagus. Lastly, the abductor muscles include the piriformis, superior and inferior gemellus, tensor fasciae latae, the sartorius, gluteus medius, and minimus. Its function is to move the thigh away from the body's midline. Next, we will be talking about the thigh muscles that move the knee joint and leg. The thigh muscles that act on the knee form the most of the mass of the thigh. The muscles in the thigh are separated by deep fascia into anterior, medial, and posterior compartments. Firstly, for the anterior compartment, it is composed of the large quadriceps femoris, which is the most powerful muscle of the body. The large quadriceps femoris is combined with four heads: the radius femoris, the vastus lateralis, the vastus medialis, and the vastus intermedium. The four muscles converge at the quadriceps tendon. The medial compartment, the glacialis, flexes the leg as it spans the knee joint. Posterior compartments. It contains three hamstring muscles: the bicep femoris, the semimembranous, and the semitendinosus. The last topic I'll be talking about is the leg muscles. The deep fascial compartments of the leg are separated into three compartments: anterior, lateral, and posterior. Anterior compartments, the extensor digitorum longus, sends four tendons to attach the dorsal surface of toes 2 to 5. The extendor iliacus longus extends a tendon to the dorsum to the great toe. The tibialis anterior is the primary dorsiflexor of the foot and ankle. The foot at the ankle. Lateral compartments. The fibularis longus is a superficial lateral muscle that converges the tibia. The fibia, sorry. The fibularis brevis lies deep to the fibularis longus. The last compartment is composed of 7 muscles, and this is the posterior compartment. The superficial layer of the posterior compartments contain the muscles such as the gastrocnemius, the calf, and the soleus. The deep layer of the posterior compartments contain muscles such as the flexor iliacus longus and the tibialis posterior. I would like to thank you for listening to my presentation. I'm sorry it went a little longer, but I would also like to say that I'm really enjoying this anatomy course so far. Thank you again.